Everyone, I'm Chip Partner, Assistant VP for Communications at the University of Rochester Medical Center. Thanks for joining us today. Pediatric multi-system inflammatory syndrome, or PMIS, is a rare but serious condition associated with COVID-19 in children. It's an emerging concern among doctors and other health officials, and there have been more than 100 cases in New York State. Today, we have 4 experts from the University of Rochester Medical Center to discuss this syndrome, led by Dr. Pat Brophy, Chair of Pediatrics and at UR Medicine's Strong Memorial Hospital and Physician-in-Chief at UR Medicine's Golisano Children's Hospital. We'll let Dr. Brophy say a few words and introduce the rest of the panel.
Well, thanks very much. Obviously, with the COVID pandemic, we're learning as we go along, and PMIS is something that's relatively new to us. And so we're working with multiple different federal and state agencies to actually document and actually try and identify all of the symptoms and signs that bring kids to us with PMIS. And one of the important things here is that we have a group of experts available here at Golisano Children's Hospital at URMC, and certainly we are very interested in being part of any state-run effort to really try and identify this and certainly represent upstate on any of these issues. We have contacts at the CDC and NIH and are participating with their COVID registries as well as their PMIS registries. So today we felt it was really important because we're starting to see more and more cases of PMIS, and we're trying to really nail down what it takes to make that diagnosis. So I'm really fortunate today to have our content experts here that are in Rochester, at part of URMC, and work every day at Golisano Children's Hospital. So Dr. Brenda Ticini is our head of infection prevention at Golisano Children's Hospital. She is a pediatric infectious disease specialist and has really led our efforts to keep us safe from the COVID pandemic here at the hospital. And she and her team have done a fantastic job. And to be honest with you right now, I think the safest place to be anywhere is in our hospital, because we pay such close attention to making sure our patients and families are safe. We also have Dr. Lawrence Olin. She is the Chief of the Division of Pediatric Hospitalist Medicine. She and her team provide day-to-day inpatient care for any kids that come into our hospital, but obviously, particularly now, they have been focusing on really trying to identify those children that have COVID-related PMIS, and so she will be available for some comments too. We also have Dr. Jake Dinas, who is an assistant professor of pediatric critical care here at Golisano Children's Hospital. And Jake actually did have contact and has looked after one of our patients that was in the pediatric intensive care unit, and actually was able to provide excellent care so that this young man could go home and be back with his family at his house. I think moving forward, we will be all working together to really define how we can best provide care for our community. And we at the Golisano Children's Hospital have developed a new redesigned approach to provide safe, physically distanced care so that we can actually make sure to provide the best and safest protection for your families and our kids that we look after in our community. And I'll just end with just saying, we're really focused on making sure that we provide standard ongoing care for kids. It is exceedingly important that we get kids in for their regular child visits, and we continue our vaccination programs in the community. The more we do that, the less we have to worry about having other infections rear up in the face of a pandemic. So with that, I'm going to turn it over and we'll be open for questions.
All right, thank you so much, Dr. Brophy. You left out one member of the Golisano Children's Hospital team, Sandy Strong, who's wearing a mask as part of the UR Medicine redesign today, is also with us, but won't be taking questions. Got a full complement of reporters. Thank you all for joining us. First up, Rebecca Pfaff from WROC TV Channel 8, and then it's going to be Pat Musadak from WHEC Channel 10. Rebecca, do you want to lead off?
Hi, yeah. So thank you everyone for being here, of course, and answering our questions. My first question was, we know this has a name now. We know that it is being associated with COVID-19. Does this mean that parents should be running out and getting those antibody tests for their children? Does that sort of heads up give them any extra time? Is there anything that they can do, or is this just something that we're learning as we go?
So I think the most important thing for parents to know is to be vigilant about their child's health and still continue to maintain social distancing and masking and all of these measures that have helped keep our rates of COVID infection in Monroe County and the Finger Lakes region really fairly low. And that's what's really preventing getting COVID to begin with, is what's going to prevent children from getting the PMIS. With respect to the antibody test in particular, that can be a difficult test to interpret for any one person, because it all depends on how likely it is that you think you have the infection to begin with. So the antibody test shows possibility of having had the infection previously. But as I said, there are other things that you need to think about when interpreting the test for any one person, and that really needs to be done with your child's doctor.
Rebecca, did you have a follow-up question?
Yeah, I mean, I think we've talked about we've discussed some of the potential symptoms before, but for me, I'm just thinking about what parents will be asking right off the cuff. Can you break down the symptoms for us again? What parents should be looking out for when it becomes an issue enough to go to urgent care, go to the hospital?
Sure. The first symptom to look for would be fever. And to back up a little bit, New York State is just starting to come out with some interim, temporary at least, guidance of how to think about, for doctors and healthcare providers, how to think about looking for this disease. So fever, signs of irritation of the body, which is our medical term would be inflammation. Okay. So rashes, stomach pains, other abdominal symptoms, irritation of the eyes or in the mouth. So swollen red lips, swollen tongue, swollen tender hands and feet. And then other things that your child's doctor may look for could be on lab tests or an exam. But for parents, fever, abdominal belly symptoms, rashes, and the red, swollen hands, feet, lips, mouth, irritated eyes.
Thank you so much, doctor.
Sure.
Thank you. Next is Pat Musadak from WHEC Channel 10 and Wendy Wright from Spectrum News. You'll be after that.
Good afternoon, everyone. This question is for the doctors. Any doctor can jump in. I'm trying to put this in perspective. How many children in New York State, how many children in the greater Finger Lakes area, and how many children in the country have come down with PMIS?
So I think the jury is still out on that. As we start to really understand and define the syndrome, some of the cases that we're finding actually are in perpetuity. So we look back and we see youngsters that have presented with symptoms that we're starting to define. So we won't have an exact number on it. I know in New York State we have over 100, and in our region we think there's probably been give or take 5 or so in our particular community. But I think that, again, the jury is still out on it as we start to understand the evolution of this particular inflammatory syndrome. The data from Europe lagged behind the initial COVID pandemic with the adult acute experience in terms of ICU care. And so I think as the pandemic unfolds, we'll see more and more cases. Altogether, though, fortunately for us, I think this is a relatively rare syndrome, but again, vigilance is really important.
Pat, did you have a follow-up question?
Yes, I know you just said it's relatively rare. This came out of nowhere. I know, we've been talking about flattening the curve. Is there a curve here as well that we need to flatten soon?
The curve that we were focused on flattening was really based on the acute events that we saw more in the adult population and making sure we had hospital-based capacity to care for individuals who needed critical care. In the pediatric world, fortunately, we didn't have that same kind of focus surge, but I think now that we have an understanding that there is a potential subsequent event that can happen around COVID infection, probably post-COVID infection, we're going to have to really watch the evolution of this. I don't think it's going to be as probably overt as the initial COVID pandemic in the adult world. But again, being vigilant, having a way to actually describe the syndrome, the symptoms, and the signs, and then getting that word out to our community of caregivers is going to be a really important part of trying to manage this process.
Thank you, Pat Mucinek and Dr. Pat Brophy. Next up, we have Wendy Wright from Spectrum News, and after that, Tanner Jubenville from 13 WHAM. Wendy, do you have a question for our panel?
Yes, thank you, everybody. How are you identifying these patients and treating them in the hospital as opposed to the children who have COVID? What are you doing differently to identify them and treat them?
So we, as everyone has said, we're learning as we go, and it's recognized that some of the particular things that make this presentation of PMIS different relates to some of the vital signs that the children are presenting with. What we've heard a lot, from the adult experience is a lot of the patients present with breathing difficulties, and for pediatrics, for this PMIS, as Dr. Tassini has already mentioned, there seems to be a lot more to do with inflammation of the body and abdominal pain and these fevers as well. And so as we're evaluating these patients, and once they meet criteria to be hospitalized, we're monitoring their vital signs very closely. The laboratory evaluations also suggest certain findings related to that will suggest PMIS, and the combination of all those factors are really what is prompting us to think about this syndrome.
Thanks, Dr. Solon. And Wendy, did you have a follow-up question?
Well, you just wanted to clarify that a little. So can this syndrome be given to another child? I think that's what I was getting to also. Do you separate this patient from a COVID positive patient? How does that work as far as what you know to this point?
So I can handle that part of the question. So any child that we suspect may have this syndrome, we certainly do test for active COVID infection, and that's by the swab test using a PCR. I think a lot of people are familiar with that term now in the era of COVID. And so that's looking for the actual virus itself. And we may even do that a couple times to try and see if we can find the virus. But what we know about PMIS is that it actually seems to happen after the infection has resolved. So the child may never show those typical signs of the acute COVID infection like we've seen in hospitalized adults. So these children, if we cannot find the virus, then they likely do not pose any risk of spreading infection to any other children. because the virus has already come and gone, and the syndrome, the symptoms are really from their own immune response. And we think it's from the immune system being overactive, and that's where all that inflammation and irritation comes from.
Thanks, Dr. Tassini.
Thank you.
Tanner, thanks, Wendy. Tanner Jubinville from 13 WAM TV, and next, Patty Singer from Minority Reporter. Tanner, do you have a question?
Hi, good afternoon. I'm reading that some of the symptoms of this could be like inflammation of the heart, blood vessel, skin, eyes. I mean, I'm curious, you know, when these kids are in the hospital, I mean, are they experiencing, I mean, are these painful symptoms? I mean, and how long are they in the hospital for with these symptoms?
I can address that one. So we had a patient last week that presented with PMIS. I actually spoke to the patient's mother this morning just to make sure that it would be okay to talk about him, but he presented with abdominal pain, so much so that there was concern that he had appendicitis. He presented, he talked to his pediatrician, he talked to an urgent care center, and there was concern. He actually was admitted to the hospital with concern for some abdominal pathology. So there was a little bit of pain there, but it wasn't the typical pain that we've seen with some of these adult patients of respiratory symptoms. So that was a little bit different. And then it became clear the longer he was in the hospital that it wasn't really an abdominal problem, other than it was just overall inflammation of his body. So he had the typical findings. The lips were red, his eyes were red, and a lot of his lab work suggested that he was quite inflamed.
A follow-up, Tanner?
I guess overall, what is the most concerning about this syndrome?
So I think in general, the concern, we're seeing a lot of effects both in the abdomen, but also a lot of effects on the heart. So when the heart has inflammation, it sometimes can beat faster than it normally would. It can beat a little less efficiently than it normally would. So that was our primary concern about our patient last week. We brought him into the ICU so that we could monitor him very closely, with concern that it wasn't just his abdomen that was inflamed. Thankfully, he did very well. He never had to have any type of advanced support for his heart or lungs at all. And speaking to his mom today, he's doing really well. So thankfully, none of those more serious complications were seen with him, and he's doing great.
Thank you, Tanner. And Dr. Dinas. Patty Singer, you're up next, then James Brown from WXXI, and I see someone from the Livingston County News may have joined. If there's a reporter from Livingston County News that wants to ask a question, just type your name in chat, please, and we'll put you in the lineup. Patty, do you have a question?
Yes, thank you. So right now it seems we have very small numbers. We've known with adults the burden of disease in minorities has been disproportionate. What are we seeing with this syndrome with children as far as racial, ethnic makeup, anything like that? Again, I realize there are small numbers, but what are we seeing so far?
You know, I don't think that that we can answer that question adequately. We just don't have enough data. We're still gathering cases from across the country. There will be information that will likely be forthcoming hopefully in the next couple weeks on that in terms of racial disparities, but I couldn't give you a proper answer on that question at the moment. It's certainly something that people will be looking at, though.
Follow up, Patty?
Yeah, to that point, and also let me back up a little bit. Are there any sort of corollary symptoms, what we're seeing with children and adults, that again are going to be looked at as we see how this affects racial makeup with children? I think I kind of butchered that question, but you're furrowed. I think you've heard worse questions. You can probably figure out where I'm going with this, Doc.
I think there's a lot of complexities to that question as well as the answer. You know, I think one of the keys is to make sure that people are feeling comfortable and have access to care. And so one of the important things that we're really trying to message here at Golisano Children's Hospital is is if you are concerned as a parent about your child, no matter where you are, urban, rural, wherever, please reach out to your physician or your provider and ask the questions you have to ask. And I want everybody to know that we provide a safe environment for kids to come in. Everybody that gets admitted to our hospital in the children's area is going to be tested for COVID, so we'll be able to understand if people are at risk, and we will be guided in terms of management based on the symptoms that the kiddos have. So it's really open, and don't be afraid to come to the hospital. If you have questions, reach out. Now's the time to do it, because I think we realize that this virus looks like it's the gift that keeps giving. So with our colleagues who look after our adults with COVID, they've faced an initial very acute onset. And what we're seeing now is what appears to be a more delayed response. So if you have questions, please reach out no matter where you're from.
Thanks, Patty. Next is James Brown from WXXI News, and following James, Steve Orr from the Democrat and Chronicle. James?
Okay. When you say this affects pediatric patients, it seems pretty broad to me. It could affect teenagers and kids that are pre-puberty. Do you know if it's mostly teens or mostly younger kids who are affected by this?
What we know so far, and a lot of what we know is from here in New York State, actually, in terms of our country, as well as in the United Kingdom. Italy is starting to look at this also. What we know from the, again, small case numbers, say school-age children and preteen teenagers would be the main age groups that seem to be affected by this. New York State and their registry wants to capture anyone with symptoms and lab findings that are consistent with this in the under 21 age group.
And a follow-up, James?
Yeah, and Governor Cuomo has said that New York State was hit by a slightly different strain of COVID coming through Europe. I'm wondering if perhaps this is from a different strain, or is it too soon to know that? Or, and also a little bit of clarity in terms of it's associated with COVID. So do you have to have COVID first in order to get it? Or is it, I'm pretty unclear on that element. Sorry, that's two questions.
Quite right, and quite understandable as we're all still trying to figure out all of the potential manifestations associated with a COVID illness. So there are very, very slight genetic differences in different of the SARS-CoV-2, the coronavirus that causes COVID, slight genetic differences in if you sample it from different parts of Asia versus Europe. And it did seem that the cases coming into New York seem to be more of the Europe, more linked to the European virus. It is way too early to tell, though, if that has any impact on a potential association or propensity to be associated with PMIS.
Thanks, James. Do you want to say that, Christine?
Not about that part.
And Steve Orr from the Democrat and Chronicle.
Thanks. I wondered if it's known yet roughly what proportion of kids who are infected with the coronavirus are developing this syndrome, and if there are any risk factors that have become apparent that might indicate why one child could come up down with the syndrome and another might not.
Yeah, unfortunately, I'd have to say it is still too early to tell which children who are infected with COVID may develop this associated syndrome afterwards. And we're still understanding how many kids are infected with COVID and what does that look like in children during the active part of infection. So we still don't know that, but I would say we do know it's quite a rare complication overall.
And Steve,
if I could ask another quick question. Is there anything analogous to this syndrome that's appeared in adults? I mean, a sort of immune system overreaction kind of syndrome?
So part of the COVID illness in adults who have severe disease, they do also have signs of a strong immune response or overdrive of their immune system. And for the adults, as Dr. Dinas was mentioning, and Dr. Olin as well, it seems to affect their lungs predominantly. They get the ARDS, severe lung inflammation, and that's what drives a lot of their critical care needs in adults who have severe disease.
Thanks, Steve. We're going to unmute the LCN video to see if there's anyone from Livingston County News on the line that wants to ask a question. That's fine. I wanted to ask one question myself, and if there's any reporters on the line that have a follow-up, let us know now. We've got about 4 minutes left. We've talked about a lot of questions about this disease that aren't answered. Is it something that can be treated when a child does present in the hospital? Are we able to take care of them?
Absolutely. So we have everything here at Golisano Children's Hospital that we need. I think the case that we had last week showed really how well we're positioned to handle these cases. So the information we get coming out of the UK and other international places is that you need a cardiologist. We have a cardiologist that works right on our floor throughout the day. So when this patient came down to the ICU last week, we literally walked across the hall to go talk to our cardiologist. Our infectious disease team was available immediately. In fact, I had ridden the elevator with one of our infectious disease doctors right before that patient came and just had an informal chat about some of the things that we were seeing. So she was right available as well. We also have rheumatology if we need it. These are some of the doctors that and experts that are needed to treat these cases. So we have everything we need here. And then in addition, in the ICU, if any patient did need advanced respiratory support, advanced cardiac support, we have all of that here at Golisano, and we're well prepared to take care of these cases.
Okay, thank you, Dr. Dinas. We've got I think a final question from James Brown at XXI, but first he's trying to put me on the spot to ask me to pronounce everyone's name. I'm going to ask you to pronounce your own name. So maybe starting with Dr. Brophy and then Dr. Tassini, just if you'll say your names.
So my name is Dr. Patrick Brophy.
Dr. Brenda Tassini.
Dr. Lawrence Olin.
And Dr. Jake Dinas.
All right, thank you all. And James, and then I think I see another question coming from Wendy Wright. James, what's your final question?
Earlier in the presentation, I heard that you're working with federal agencies on this. What agencies are you working?
Sorry, I lost.
Yeah, I think the question is, what federal agencies is Golisano working with?
Sure. So we actually have been part of registry through the CDC as well as the NIH, where they have asked us, along with New York State, to collect the data on patients we suspect of having PMIS. And those data will be collated, obviously, in New York State, but also on a national level from across the country, so we can actually better understand the prevalence of PMIS and the constellation of symptoms that really go together. And that will also allow us to understand the demographics, the racial distribution, as well as the potential for treatment approaches. And so there's real strength in numbers here. We also have national networks of the Pediatric Hospital Medicine Group called the Popcorn Network that has been vitally important to actually have rapid transmission using webinars and platforms to really get information to each other across the country and actually around the world. And so, you know, we are very tuned into this, and we have the content experts here to actually really, I think, be a leader in this whole area.
Thank you, Dr. Brophy. Two final questions. One's, I think, a little shorter and simpler from Minority Reporter. Are there visible signs of inflammation like hives? Can you see can a parent see the inflammation?
You can definitely see visible signs. It may come in the form of a rash, not necessarily hives, but red rash on the skin. And as Dr. Tassini and others have mentioned, you can see inflammation or redness of the eyes or the lips and tongue as well, and sometimes some swelling of the hands or feet.
Thank you, Dr. Olin. And a final question from Wendy Wright at Spectrum News. Is there a concern that parents may not be bringing, keeping their children home because they're afraid of being exposed or their children being exposed to COVID and if they come into the hospital or the clinic?
Yep, I think that's a pretty common interpretation. In other areas of the country, we've actually seen vaccination rates fall because parents were worried about bringing their children into clinics for their vaccination and child checks. And fortunately for us, we've actually worked very closely with our community primary care groups, pediatricians, family practice physicians, and we do not see that happening in Monroe County at the moment. And so our focus is really to develop our new redesigned effort to make sure that we are very safe in all kids and families that come to see us. So you will see a very different process than people have seen in the past. And our focus is on masking, washing our hands, physical distancing, testing. Each child that comes in to be admitted to our hospital will be tested. In clinics, we actually are able to set up our space so that we can have patients visit in a proper physical distanced way. So our focus is on this. Our cleaning procedures are pretty pristine. And our focus is really to keep everybody safe. And again, I think the Children's Hospital is one of the safest places to be right now because we are so aware of this. And our clinics are doing the same thing. So I'm pretty confident that we'll be able to have good, safe opportunities for kids to come and get care. And please come and get care. Don't ignore it. We don't want to actually have kids that need care with people fearing to come in. Get the care they need.
Thank you so much. Thanks, Dr. Patrick Brophy, Chair of Pediatrics and Physician-in-Chief for Golisano Children's Hospital, Dr. Brenda Tassini, Dr. Lawrence Olin, Dr. Jake Dinas. I want to thank our ASL translation crew, Morgan Underwood, Will, who you see on camera, and Lauren today was off camera helping with our signing. I want to thank Jeff Mead, our videographer and video producer, and Max Reckert, who ran the Zoom today. If you have follow-up questions, anyone on the call, please send them to mediainquiries@urmc.edu. And with that, we'll thank everyone and end the meeting.